Hello dear patients, today we are going to review the case of wart removal by nitrogen. Nitrogen is a liquid which is of minus 196-198 degrees. We often have patients coming to us for removal of warts by nitrogen, and we will review it on a particular example. A woman came to us with a wart in the area of foot. It's no doubt that it's easier to remove superficial warts by nitrogen, for example on body, on dorsal surface, etc. However, when the patient doesn't want to remove by more modern methods, such as radiowave method or laser, or if he has prejudice against them, or if a person is afraid of anesthesia or has allergic reactions, and in many other cases, we remove warts by nitrogen. So in this case a cane method is used, a wax is put on a stick. In our clinic we also have a cryoinei apparatus that we use in some cases. Generally speaking, there are no global differences in using cryoinei for warts. When a cryoinei apparatus is used, the temperature that liquid nitrogen has is transferred through a metal tip. Basically, this is the same freezing. So what should you be ready for? First of all, for the fact that removal of a wart by liquid nitrogen is basically a burn, but not by heat, by cold, but with the same consequences. Wax tampon soaked by nitrogen is applied to a wart. It gets white, it hurts a little, usually severe tenderness doesn't appear, so anesthesia was not used in this method for this patient. So it gets white and then takes the color of a normal skin. The removal takes a minute or two. For 1 or 2 minutes there is a contact of liquid nitrogen with the wart itself. After that either reddening or a classic blister is formed. If it's big and expanding, then it's advisable to open it up at home, in aseptic conditions or in clinical settings. So when the results can be expected? Some patients want to see the final result in a day, however this doesn't happen. It's no doubt that this burn has to be resolved completely, and the results should be expected no earlier than 2-4 weeks after such removal. If a wart is quite deep, in this case it's not so deep, but we have people coming with big and old warts, particularly if they've done something at home, then in this case not one but several removals are required. The same is true for sublingual warts, etc. In this particular case only one removal was required. So it's necessary to take care of these removals, first by external disinfectant medications such as hydrogen peroxide, chlorhexidine, and to use healing ointments like panthenol for burns, for example, or levomecolum. Usually this is quite enough for a normal healing. Can you walk after removal by liquid nitrogen? Of course you can, you shouldn't run, but you still can walk after removal by liquid nitrogen. So, for this particular woman, a removal by liquid nitrogen was done, and no relapse of such wart was observed. If it's necessary to remove any warts by liquid nitrogen, you can consult our paid medical center of dermatovenerologic dispensary in Moscow. We have experienced dermatology specialists who remove warts and other neoplasms by liquid nitrogen. We're waiting for you in our clinic. Please subscribe to our channels on YouTube and Instagram. Thank you for your attention.